Welcome to Mercy Medical Center, Centerville's obstetric service. We've been delivering babies for over 100 years, and we offer a higher level of care for your baby with the area's only pediatrician on staff. Our highly dedicated and specially trained obstetric nurses will take you through labor and delivery and provide you with free checkups after your discharge from the hospital. We also provide the area's only breastfeeding support group, as well as the prenatal training that you are about to view, all in an effort to assure that you are well prepared for the big day.
So one of the most exciting times of being pregnant is trying to decide when it's time to go to the hospital. So today I'm going to talk to you a little bit about when you should go ahead and grab your bag and head out. So the first thing you'll notice is contractions. Most everyone, when they start having them, they get very excited and they jump in the car and they come see us, and sometimes we end up sending them back home. So a good rule of thumb is to sit down, lay on your left side actually, and drink some water. If your contractions stop, probably you can stay home. If your contractions continue and they get stronger, longer, and closer together, then it may be time for you to come see us. Usually we say we want you to come see us when your contractions are about 5 minutes apart, lasting for about a minute long. If you live further away or you have a history of having a baby very quickly, we often will have you come in a little sooner than that. So ask your provider for specifics for your special circumstance. The other thing you need to know is how to monitor those contractions. Contractions are monitored from the start of the contraction to the start of the next contraction. There are a lot of great apps you can get on your phone now that everyone's using. It makes it very simple, so you can just download a contraction monitor app, and when your contraction starts, you'll push start, and when it stops, you'll push stop. And then when you have your next contraction, you do the same thing, and it'll tell you how close your contractions are together. So those are really handy, but you can just do the old-fashioned watch the clock too. I like to have a notebook and start writing in the start and stop times. So the other thing we want you to know is if your water were to break at home, we want you to pay attention to what color that fluid is. We want it to be kind of a clear, light tan color, but if it's different colored, we need to know that. So just pay attention. When your water breaks, sometimes it's a gush, sometimes it's just a trickle. So if you feel like you're peeing yourself uncontrollably, your water might have broken. So now I'm not going to promise you didn't pee yourself. Sometimes that happens too, but we're happy to check that out and we can tell you the difference. So if any of these things happen, we do want you to go ahead and give us a call. It's always good to give us a heads up prior to coming, and then we can get all ready for you. If indeed it is time to go to the hospital, we want you to remember to bring a few things with you. We want you to bring your car seat. We want you to also bring your hospital bag. There are a lot of things that you can read on the internet about what you should bring in your hospital bag. The important things I will tell you to bring are slippers or flip-flops, something to put on your feet. We do have hospital socks here we'll give to you, but most moms in labor prefer to have something a little more comfy for walking the halls. So don't bring your favorite pair of sneakers, don't bring anything white or anything that you're gonna be sad if it gets ruined and bled on. So, but a good pair of flip-flops is always handy because you can just throw those in the shower and rinse those off. The other things you'll want to have is something to bring baby home in. It might be beneficial to bring a couple different sizes of outfits because you never know what size baby will be. We can all guess prior to delivery, but babies surprise us. So bring something that would be newborn size, and maybe something on the small end, and then something again on the larger size of newborn, so you can bring baby home in that. The other things that are handy to bring are snacks for dad. You can bring your own pillow if you prefer. I always tell my labor patients not to worry about wearing your own clothes during labor or delivery because you will make a mess, and so let us do the laundry for you. So we'll provide you with everything you need. Some women like to have chapstick. We do have chapstick here, but if you have your own favorite chapstick, definitely bring that. We'll provide you with a water bottle and things like that so we can monitor how much you're drinking. Sometimes a bathrobe is nice because after you have the baby and you want to get up and walk around, that'll make you feel a little more human to throw on your own bathrobe and look a little more presentable. You'll definitely want to have your comb and your brush. If you wear makeup, your own toothbrush is always nice. You'll definitely want to have your own shampoo and conditioner. We do have some soap here, but probably not going to do what you want yours to do. So Definitely bring your toiletry items with you. For Dad, he could also have a pillow if he's going to stay here with you. That would be nice for him to have his own pillow probably. We'll provide you with blankets and sheets and a place to sleep. Snacks is always handy to have in the bag. If you think it's time, I want to just give you a little bit of advice that you wait to call all of your family and friends and tell them that today's the day and baby's coming. So go ahead and head in and let us get you checked out and get you on the monitor and give you a good idea of whether or not today is actually the day. We've had several situations where everybody comes in and then we have to send you home, and maybe it's 3 a.m. and mom and dad, they're not maybe overly excited about us sending all of their 20 visitors home at that point. So just hold off on calling everyone and posting to Facebook and whatnot, and we'll give you a good idea once you get here whether or not it's go time. Come through usually the front doors. If it's after hours, you'll need to come into the emergency room entrance, and you'll make your way down towards Station 2 and into the OB unit.
And now you've arrived to the OB department. So the first thing that we ask you to do when you get to our department is to give us a urine specimen and to change into a gown. So we'll provide you with those and have you do that first, and then we'll ask you to get into the bed and we'll hook you up to the monitor. This one is the ultrasound, and it will let us listen to baby's heart rate. And then this one is called the tachometer, and it will monitor for any contractions. We put some warm gel on this one and position it to find the baby's heart rate. We will strap these on, and then the tachometer will go at the top of the uterus. So you'll be hooked up to a pulse oximeter, which we'll place on your finger.
Okay.
We will also put on a blood pressure cuff. Depending on how things are going, you will have times that you can get up and move around. So now you've been on the monitor for 15 minutes, and we've determined that you truly are in labor. So when we've decided then that you're going to stay, we will get an IV started so that we can have fluids running if need be. We will switch you over to a clear liquid diet, things like Jello and juice, ice chips, ice water to prepare you for delivery.
All right, so we've decided that you're in labor. So I'm going to go over kind of how the next part of this is going to go. And I'm going to give you a lot of information. Please ask questions if you have any questions, okay? So now that we've determined you're in labor and we've told you that as long as everything looks good on the monitors, we're going to let you get up and walk around. So I have to monitor you 15 minutes out of every hour. So I like to do that at the top of the hour. So I'll monitor you from say 8 to 8:15. I'll let you get off and walk or use a birthing ball or get in the shower, do any number of things until 9 o'clock, and then at 9 o'clock we'll get you back on the monitor until 9:15. We'll continue on that way as long as everything looks good and as long as you can, and unless we end up having to use one of those medications Kyla was talking about for induction, such as Pitocin or the Cytotec. That would definitely change our course of action, but otherwise we will keep you out of the bed. I find that something about being in this position just causes a lot more discomfort. So I like to have my moms up and moving as much as possible. At the end of it, women tell me it definitely helps quite a bit. So I'm going to talk to you about a couple of things you can do, and I'm going to show those to you while you're up and moving, and some of the ways we can maybe help baby come down through. So the beginning stage of labor is really from where you are now, which is pretty comfortable, and all the way through to 4 or 5 centimeters dilated. At the point that your cervix starts dilating kind of quickly and moving in a good direction, and we're seeing a lot of change, then we'll call that a more active labor. This beginning stage can take several hours, so we don't want you to get discouraged and we don't want you to be exhausted. So it's really important that you don't be running up and down the halls and, just overexerting yourself so that then, come night shift and it's time to push, you're just so exhausted. You don't have any energy to do that. This is also a good time for visitors because you'll still be in the right mindset to accept visitors and kind of be clear, but be thinking about the fact that we're moving toward a phase that it will not be fun for visitors to be present. So say your hellos and do your greetings, but you might not post all over Facebook that you're in labor and we're having a big party. Come on down and join us. The other thing that I'll tell you is that through night shift, sometimes moms like to lay down and rest, and they don't want to continue to walk through the night. That's person to person. Some moms have so much adrenaline they just can't help themselves, and no sleep is going to come. That's okay. But if you're someone who can lay down and take a nap through your contractions, absolutely we want to encourage you to do that as well. So we want to make sure you're relaxed, and whatever that is for you, we're going to help you get there. So once you get to that 4 or 5 centimeters dilated, things will get a little more interesting. Your pain will increase, and at that point it'll become important for you to use techniques to stay comfortable. If you choose to use pain medication, at that point we will discuss that with you. We'll have you sign some papers to give us approval. We can do things like an epidural, we can do a intrathecal, and we also have IV pain medication. Some moms opt to have absolutely nothing, and so we use showers and swaying and massage, deep breathing and visualization exercises to keep you comfortable. If you decide you want to use an epidural, an intrathecal, or any other form of spinal medication, we will have you sign those slips pretty much right away. If you're not sure whether you want to use one or the other, we'll still have you sign it, because if we give you any IV medication such as fentanyl, which is what we often will use in labor for a mom that requests that, then it's a narcotic. So we're really not, after that point, comfortable having you sign things or make any big decisions for yourself. So if you already know you want one, we'll have you sign it. If you're not sure you want one, we'll have you sign it. Otherwise, we can have your support person sign it, someone, your spouse, or someone who would be able to legally sign for you. They could sign for you if you change your mind later. If the epidural, the intrathecal is a one-time medication that is placed near your spine, and it'll numb you. Okay, so let me show you some of those things we talked about that we can use during labor to help bring baby down and also to help increase comfort and relaxation for you. The first one, and my favorite, is the birthing ball. We have this nice chair here that you can sit on, and this will help open up your pelvis and bring baby down and through, and it's a really great option to use during labor. You can sit on it 2 different ways. I'll kind of show you my preference, or maybe the traditional way. You're going to sit on it kind of like a chair, but you notice you're going to kind of put your hips a little further back, and you're going to kind of lean forward. This is nice. We can put it up against the bed and give you some pillows so you can kind of lean forward. You can rock around on this ball and move and try to help move baby down through. It feels pretty good in the middle of labor to have kind of this soft squishy ball you can move around on. The other way you can use it is you can sit on it kind of backwards, if you will, and kind of lean over the back of it like this. We'll put a cover on it, and so it won't be cold. It'll be nice and warm for you. But both of these options work great for helping bring baby down. The other option we have is our peanut ball, and this we use this most often if you're going to stay in the bed. So if for some reason you want to take a nap, or you have an epidural so you can't get up and move, we can use this. Or if we're using one of the other forms of inducing your labor, that means we have to keep you in the bed, then we can use this. This just goes between your legs, underneath the leg, and it'll kind of open your pelvic area, and again just kind of give a little more room to bring baby down. I do want to mention that Even if you have Pitocin, we can sometimes use these options. So you don't have to stay in the bed. You have to stay on the monitor, but you don't have to stay in the bed with Pitocin. So as long as we can pick up baby and your contraction pattern, we can still get you out of the bed, have you moving around. The other option is that this bed sits all the way up, and so some moms prefer to push or to labor kind of up over the bed in a squatting position. So we would just have you turn around on your hands and knees and put your arms up over the back of that bed, and then we would work with you to be comfortable there. The bed also goes up in the air quite a bit, so you can be swaying next to the bed, someone can be behind you rubbing your back, all sorts of things. The shower's always great. We encourage showers. They feel amazing, and the relaxation is good for baby. All right, I want to talk to you a little bit about a few things you might see during your labor. These are some of the tools we use, and I just want you to know what they're for prior to seeing them maybe later. So this is a tool we would use if your water has not broke on its own, and we see that it would be helpful to do that. This is our amnio hook. Doctor will do a sterile vag exam. She will ask us for one of these. She will place this up beside her fingers, and it has a tiny little prick on it, and she will snag that bag of water and she'll break your water with this. So sometimes we do that when you come in to help speed up your labor. Sometimes we don't do that until at the very end and it's time to push and we want to break that water so we can get baby out. The other things I want to show you, we sometimes use to monitor baby. Sometimes these give us a better idea of what's going on. If for some reason we're having a hard time picking up your contractions or the strength of your contractions, we're not really sure if they're doing what they need to be doing, or we're having a hard time getting baby's heartbeat, you might see these tools. This one here specifically, Doctor would put into your cervix and attach this tiny little metal edge to baby's head. And then this will come through, it'll hook up into the monitors just like the external monitors do, and we would hear baby's heartbeat, and it's a very, very consistent way to monitor that baby's heartbeat if we need to do that. This one here, she places in your cervix, actually beside baby, and this can monitor the strength of your contractions. So we don't use these very often, but every once in a while we do pull these out because they're helpful to us, and I just want you to be aware that we might use those. The other thing you might see is an oxygen mask. Now this is scary for some people, but sometimes in labor you get a little out of breath, or baby is doing something we're not very comfortable with, and one of the first things we're going to do is we're going to put you on your left side and we're going to put a little oxygen on you. We won't keep it on very long. As soon as we like what we see or you catch your breath again, we'll take it back off. But don't be afraid when you see this. This doesn't mean something is very wrong. We just always want to make sure that you have enough oxygen, because if you have enough oxygen, then the idea is hopefully baby then will have enough oxygen. So I just want you to see those items. Okay, so the next thing I want to show you is our dilation. Moms love to see this because we use these big terms and sometimes they're hard for you to understand. So I love this tool. We'll show this to you throughout delivery and keep you updated on where you're going. So if you hear us say that you're 1 centimeter, that means when we do our vaginal exam on you, that I can get about 1 finger into your cervix. And as you progress through labor, then I can almost get 2. I can get 2, now I can get 2 and move them around, and as you can see I continue up on through here, and that'll be how you will progress during labor. So you'll hear me say you're 5 centimeters, or I'll say you're 5 to 6, and that just means you're somewhere between those two there. You'll notice that this is thicker here and then it gets thinner. If you're a first-time mom, usually you get very thin before you start to dilate. If you have already had babies before, often you kind of do them both at the same time. So the more you dilate, the more you will thin as you go. But first-time moms often have to get a very thin cervix first, and then they will start to have some increased dilation, or at least it'll dilate quicker. So when we talk about early labor versus active labor, right in here is kind of where we're talking about. So somewhere between this 4 and 5, usually 5 to 6, you start getting really uncomfortable. This is what we will call transition. Sometimes during transition, you will get sick, you will get shaky, chills. you often don't feel very well during transition, and that's always a good sign. We don't mind you throwing up. That doesn't hurt baby. In fact, it kind of pushes baby down a little bit, so we're okay with that. But it's a good sign to us that if you all of a sudden start feeling different, that maybe something's changing in your cervix. And we will frequently talk to you about that, and we will check your cervix as we see the need to. If your water's broke, we won't check very frequently because we don't want to introduce bacteria. And if your water's not broke, we still won't check super often just because it's uncomfortable. So we will limit our checks, but we will check when needed. The other things we're looking for as you progress through your dilation, when you get somewhere between this 8 and 10 centimeters, often you start getting a sensation that you need to have a bowel movement. We always say, don't assume you do, tell us, because that might mean you need to push, and maybe baby's right there and ready to come. So if you get that feeling, let us know first, okay? And then we'll check you out and make sure everything's good and let you know what's going on. I'll show you this other paper that's good. The other thing you'll hear us talking about is the station of the baby. So this is your pelvis, and the baby's head, as you can see, has to come down through your pelvis. And when we're checking, we're making an assessment of how far I have to go up in there to reach baby. And so you can see here that if I have to go way far back, we would call that a -3. And then when we start coming a little more flush here, we'll call that 0 station. As we progress down through, you're going to be getting toward crowning phase. So as soon as baby starts coming down through, we start getting our plus numbers, you're getting very, very close to seeing baby in your arms. So that's always a good visual. I like my moms to see that, and we'll keep you updated throughout labor on how you're doing with that. So we're going to talk a little bit about how the pushing's going to go, what position we're going to have you in, and how we'd like you to do that. Okay, so the first thing, when we tell you that you're complete, we'll bring in that delivery table, and doctor will come in and get all gowned up. Doctor will be covered pretty much head to toe, just because for safety reasons, just to protect. And then it is still a sterile procedure, so there'll be a blue field, and we say, and we'll tell any of your guests not to touch the blue field. That's kind of the rule. So as she's getting ready, I'll be getting you into position. So the first thing we're going to do is we're going to pull your legs up here. Some doctors like the bed broke down, and some don't. So we'll get rid of anything heavy from you. This is definitely the time where you're able to, if you haven't had any pain medication, this is the time where you're going to be able to focus again. So when we push, you're going to reach your hands down behind your legs, and you're going to pull them up and out. And we want to open that pelvis if we can, so we give baby lots of room. So you see how I'm bringing your knees way out to the side? Usually we're going to help you with your feet, because that's kind of hard. You're just going to be hard to hold your legs. So we'll help you with your feet here, and just make sure you keep these knees way out to the side. You're going to tuck your chin on your chest, and you're going to take a nice deep breath, and you're going to curl up and around your belly, and you're going to push to the count of 10. One of us is going to count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're going to take a nice deep breath, and you're going to come right back, curl around, and you're going to do it again to the count of 10. We usually do that 3 times with every contraction. Every once in a while, we'll throw a 4th one in there if we're getting really close. So just follow us. We'll let you know what we need you to do. Once baby is delivered, but doctor's going to be down here. She's going to bring baby, she's going to do a couple of things here, but then she's going to usually bring baby right here. So this is where we start our kangaroo care, if you will. This is where we start our skin to skin. So if you're breastfeeding especially, we're going to be really sure to make sure that your gown can come down and baby can go right to your skin. If you're not breastfeeding, we still really want baby to be skin to skin if possible. It helps with transitioning from life inside the womb to outside the womb. So this will bring baby here. Kyla and I would probably both kind of be rubbing on baby and just making sure baby looks good. If you're breastfeeding, we'll let baby do his or her thing and get accustomed to where he or she is at. After the cord is cut, then we'll wait for the delivery of the placenta. Usually that takes somewhere between 3 and 15 minutes after the delivery of baby. It's not nearly like pushing baby out, but it can be just a little bit it can cause a little bit of discomfort. So every once in a while, mom will notice that her placenta's coming out. Usually you have to give just a little push, and then here it is. So after that, mom nurse, I'm going to be massaging your fundus. So this is kind of an uncomfortable situation, but it's very important. Your uterus is big, and when that placenta comes off, it's just like pulling a scab off of a very, very big wound, and it will bleed a lot. So we have to massage that fundus down pretty quickly to stop that bleeding and get that under control. So right away when that happens, somebody will be rubbing your fundus. We will give you a bolus of Pitocin through your IV at that same time. That Pitocin will help contract that uterus down and close that up, and then we'll check on your fundus about every 15 minutes for the first hour, hour and a half after you deliver.
My job, now that baby's born and you're doing skin to skin, is I will be checking the baby's vital signs, and I can do all of this right here while baby's skin to skin with you. Check the vital signs, listen to the lungs, listen to the heart, check a baby's blood sugar. We give newborn medications like vitamin K. We do that injection right into the leg, which is for to give baby clotting factors since they come out with a sterile gut. And then we give the erythromycin eye ointment, which I can also put right into baby's eyes while baby's skin to skin with you. We like to keep baby skin to skin with you for at least the first hour after delivery to help promote breastfeeding, temperature regulation, transition. So I will be doing the vital signs about every 15 minutes for that first hour. And then once that first golden hour is over with, we will take baby and do the weight and lengthen if you're ready for us to. There's no rush on that, so we'll just do it after we've gotten that skin to skin time in. Next, we're gonna demonstrate how to give a baby a bath. So at our facility, we typically promote delayed bathing, where as long as there was no complications, no signs of infection, and the baby is maintaining its temperature, we wait up to 2 days to give the first bath to promote breastfeeding and temperature regulation. So first of all, you will get your baby, and at home you can use a tub similar to this. Here we do a sponge bath for the first bath. So you will want to have everything assembled and ready before you start. Babies typically don't need a bath every day, so every other day or every third day. Clean clothes, towels. You'll want some cotton balls. You'll use those to clean the baby's eyes. If you have a male baby and has had a circumcision, you'll want to have your Vaseline ready with some gauze 4x4s. You'll want a brush, some baby wash, and some baby oil. We typically don't recommend that you use baby lotion because it contains alcohol, which will dry the baby's skin out even more, so you wouldn't want that. A thermometer, some washcloths, a hat, diapers, and wipes. So first off, you'll start by undressing your baby, and you'll want to keep them covered while you're working from the top to the bottom so that they don't get cold. You want to make sure that the room is also warm enough because the baby will get cold while it's wet. So we're going to start first with the head. You want to go from the cleanest area of the baby to the dirtiest. So we'll get our clean washcloth and our soap. And you'll use your cotton balls to first, with just clean water, you'll wash each eyeball from the inside to the outside, and then throw those away. Next, we'll start by getting the washcloth wet and soapy, and you'll want to scrub the baby's head and ears. You don't want to use Q-tips on babies, so you can use a cotton ball and kind of use it to get down in there. You want to check your baby's mouth and make sure that the gums are clean. There's no white film inside their mouth. You can use your clean washcloth also to just use your finger and kind of wipe out their mouth. Then you'll do the neck. Make sure you get in the neck really good, down underneath all those creases. Now is also a good time to work on range of motion exercises with your baby, moving their arms, bending their elbows, getting all the little creases under the armpits. Also, check their little breast buds. Sometimes when babies are first born and the hormones are moving, you'll notice that there might be a little drop of milk even from the baby's breast, and that's normal. You just wipe it away. So now I'm going to cover up the baby's arms that have already been washed, and we'll move on down. Next, you want to clean around the cord and the belly. Now's a good time to use your Q-tips to move the umbilical cord around and get deep down in all those creases, and just plain soap and water. Okay. Next we'll do the legs and the bottom of the feet. You can also work on moving baby's legs, range of motion now as well. The last area that you'll want to do is the back side and the front. If you have a girl baby, sometimes they'll have a little bit of bloody drainage, and that's normal as well. It's just the hormones. If you have a boy baby, you want to make sure that you get down in all the creases and lift the scrotum up and clean underneath of it. So now we will use a dry towel. And make sure you get all those little folds that you just washed nice and dry. Next, you want to keep your baby warm still. If you have a boy baby, this would be the time that you use the Vaseline and the gauze. So you just put some Vaseline on your gauze and place it over the tip of the penis and around, so that you can put the diaper over top of it. You don't want to cover the umbilical cord with the diaper. So you can fold it down, leave it sticking out. And the baby oil, you put it all over the baby. You can put it on their hair, but avoid their face. And then you'd want to take a soft bristled brush and brush their hair out. Nice and gently. Now is a good time also to look for a cradle cap. So if you're noticing that they have dry, flaky skin coming off of their head, then that could be a sign of cradle cap, and you just want to make sure you're brushing a couple times a day with one of these soft bristled brushes and using baby oil. And then you'll put your clean clothes on your baby. They typically recommend that you dress baby the same way that you would dress for the temperature. So, you don't want baby to get too warm or too cool, depending on how the temperature is in your house. And then you would swaddle the baby up.
University of Centerville, we take safe sleep very seriously. So you're going to get a lot of education about safe sleep. We like to start that prior to you having your baby, and while you're here, you'll be introduced to several things that we do to help promote safe sleep. So the first thing you'll see that we use this Halo sleep sack, and this is a really great sack that we use. It is what we mean when we tell you that we want baby to wear its blanket. So this zips up around baby. You can have a shirt on. Your baby will have a shirt, maybe some socks, a diaper, and then we will put this sleep sack on. It zips up from the top down, and then ours has a swaddle on it. You can get them at home. You can get them with or without swaddles. Babies don't like swaddles usually much past the first couple of weeks, but that first couple of weeks swaddles are helpful. And so we can swaddle baby into this, and then baby is wearing its blanket. This helps prevent blankets from creeping up on babies, and it promotes our education to keep blankets out of the crib. So this baby is modeling our safe sleep environment. The crib will have a crib card in it like this. It'll remind you that babies should sleep alone on their back and in a crib or in their own sleeping space. On the back side, it has some really great pointers to help remind you of the safest way to have baby sleeping. We also have handouts that we'll give you when you come that model, again, this safe sleep environment. This baby in this picture is on its back. There's no crib bumper, notice. There's a sheet, and the baby is wearing all of its clothes. This sleep environment here when you're at Mercy will be the same way. We do have a blanket on the bottom. Your baby will be laid in this bassinet. There will be no other blankets in here if we can help it, and no stuffed animals or anything like that will be in the sleeping space. What we know about SIDS says that the SIDS rate in the United States dropped about in half when we started the Back to Sleep campaign. We know that it is best for babies to sleep in their own sleeping space. We also know that SIDS does promote, or SIDS prevention promotes, the use of pacifiers, ceiling fans, not overheating your baby, and also they recommend that babies do sleep in the same room with the parents. So we can't prevent SIDS necessarily, but there are several things we can do to help decrease the incidence of SIDS. Also, we want to be aware that cigarette smoke is, the nicotine is very hard for babies to process through their bodies, and so we want you to prevent exposure to secondhand smoke if possible with your newborns or all babies. Also, breastfeeding is a great protective mechanism for SIDS, so we want you to really think seriously about breastfeeding if you have not. In fact, the SIDS Foundation has even said if you're breastfeeding, that's more important than the pacifier use. So if you're worried about pacifier use and breastfeeding, breastfeeding is definitely best. So again, this will just be that position we'll have baby in, and we will remind you several times while you're here how to keep baby safe. There's lots of great information on the internet, and if you have any questions, let us know.
Breastfeeding has been proven to be the best choice of feeding for your baby. It has shown to improve a baby's neurological system. Babies are less susceptible to bacteria and viruses and can fight them off easier if they've been breastfed. And in the long run, it's shown to have, you are less likely as an infant to have ear infections, different illnesses, and as an adult, it has shown that you are less likely to have diabetes, high blood pressure, heart disease. For moms that breastfeed, your risk of having cervical cancer, ovarian cancer, breast cancer is all decreased. And so when your baby is born, their stomach is just the size of a tiny little marble. So in those first couple of days when the milk is the colostrum milk, and you're only getting that small amount out, it is absolutely plenty for baby because they have such a small, tiny belly. in the first couple of days. And then around day 7, it shows that their stomach is the size of a ping pong ball. And typically around days 2 to 5 is when your milk will transition to that mature milk. So as your milk is transitioning and becoming a more larger amount, their belly is also growing. So any amount of breast milk is better than no breast milk at all. And if breastfeeding doesn't work out for you, that's fine. Then there's always the option of formula feeding. So we can also go over formula feeding with you one-on-one to show you the correct way to prepare it and the recommendations of what kind our pediatricians recommend. So get a hold of one of us and we'll meet with you and set up a plan for your infant feeding choices.
Before we send you home, it's really important that we make sure you have a proper fitting car seat for your baby. So when you're purchasing a car seat, make sure that you do get an infant car seat. There are 2 different kinds. There's a convertible car seat, which stays in your car. It can only stay in your car. So that's not one you're going to be able to take out of the car and bring inside. You have to be careful using those in the heat of the summer or even in the cold days of winter, because your baby is too small to be able to regulate temperature very well. And so we don't want to put a newborn into a very hot seat or a very cold seat. They would either transfer heat or lose heat very quickly to that seat. So we prefer that you use an infant car seat that you can carry with the handle that you can bring in and out of the vehicle that snaps into the base. Car seats are weighted, so please make sure that you get one that's appropriate. Most car seats now will go down to about 5 pounds and up to 20, sometimes even closer to 30 pounds. The Iowa law on car seats is that your baby must remain in a rear-facing car seat until they are 1 year old and 20 pounds. A couple of the complimentary things we offer here at Mercy Medical Center include a free 30-minute massage prior to you discharging, and we also bring up a special complimentary dinner for mom and a guest of her choice.
We look forward to seeing you soon, and thank you for choosing Mercy Medical Center Centerville for your obstetric and baby care.